a strip of hair-bearing skin is taken from the donor area in the back of the head. We know that hair on the back of the head is resistant to the genetic and hormonal mechanisms that cause hair loss. So we can borrow that hair and put it on the top of the head or where a patient is losing hair, and it will grow forever. That experiment was proven in 1932 by Ehrenreich, whose grandson still does surgery in New York City. And the Japanese claim they invented it, but they just stole it from the Americans. And one of the patients that Ehrenreich did surgery on is still living today, and he still has his hair. So we know that hair restoration works. So basically, that strip of skin is taken, put under a microscope, and all of the follicular units and grafts are extracted from that strip. The defect in the back of the scalp is sewn together, and the way I sew it together results in a pencil-thin scar back there. So the patient, as a necessity, will always have to wear his hair just a tad longer to cover that, because there's always going to be something back there. The hairs are implanted in tiny little puncture wounds in the top of the scalp where the thinning areas are. And about 4 to 5 months later, you start to see the beginnings of growth. And in about a year and a half, you have full growth.